and nabiximols. Um, so there's a lot of evidence around that particular cannabinoid formulation. So that's normally a good starting place for us with patients who have pain, kind of start, and we can, based on how that affects them, we can kind of play around with those THC and CBD concentrations. Maybe it made them a little bit too sleepy during the day. So then maybe we want something that's CBD dominant. So maybe we want a 1-to-2 instead of a 1-to-1. And you can see on the chart more than just THC and CBD. There are hundreds of other cannabinoids we're finding in these plants. CBN is a new one we're finding. It's really good for sleep. CBG has shown real promise for anxiety. So more and more we're starting to formulate cannabis products with these specific cannabinoids. And then the other thing you see on here, the terpenes. So those are their aromatic compounds. So they give cannabis, well, they give all plants their like smell and their flavor. And they also provide medicinal benefit. So, for example, linalool, that is a terpene that's found in lavender. So it's going to have that flavor and that scent, which I know is controversial. I love the smell of lavender personally. But we know like spritzing your pillow with lavender before bed promotes a more restful sleep. Limonene, that's another terpene that's it's a citrusy kind of flavor, and that's been shown to boost your mood, improve focus. It's thought to be a more energizing terpene as opposed to linalool is more sedating. And then caryophyllene is another terpene I like to mention because that is the only one of these terpenes that mimics CBD. So it actually can interact with cannabinoid receptors in our body. So that one is something you really want to have in your cannabis product if you're looking to treat pain or inflammation. The, the terpenes, though, I will say, like, those are going to be more relevant to the inhaled products, like the flower or the vape extracts. So, and that kind of brings me to my next point. Do you have to smoke? Like, do you have to inhale in order to actually like use these products? And no, you don't. Nowadays, we're formulating all kinds of things. Inhalation definitely is still the most popular form of consumption. It's still highly favored among users. But we have all these other options now. So we have topicals, lotions, patches, suppositories. Right now, we have an Epsom salt soak-in right now. Like, that's amazing. Most of them are topical, but a few have been formulated to be transdermal. So they're thought to penetrate your dermis, your epidermis, and actually reach down into your nerve endings. So really good for neuropathic pain. And those transdermals, they theoretically could like reach your bloodstream. So the topicals, those are non-impairing. You wouldn't feel any sort of head high. There is a really slight chance that with the transdermals, there could be some low, really minor impairment. I've personally never seen that happen, but the folks who make these products always kind of leave room for that to be a possibility. And then other than topicals, we have some ingestible products, we have sublingual products. The ingestibles, those would be like a capsule, a tablet. They're long acting, so maybe 5 to 8 hours, and that's a general range. I mean, I've seen them last shorter than that. I've seen them last longer. And that's kind of the trick with the ingestibles is like they are kind of more variable, especially the onset. I've had edibles take effect for me within 15 minutes. Sometimes they take an hour, 2 hours. So that's kind of a tricky thing, but there's ways we can manage that. So like we'll always, recommend patients try to be consistent with when they're taking their medicine, like in relation to what they've eaten. We always recommend they take it with something fatty that improves absorption. So we have ways to kind of manage that. Um, excuse me. The sublinguals, those are a pharmacist's best friend at the dispensary. So um, those are tinctures, syrups, lozenges, or you'll see the lozenges also called troches or gummies. Really, we love the tinctures because those come with a marked dropper um, that's marked down to the 10th milliliter. So it allows for really precise dosing and titrating. So we can work within 1 single milligram and really find your precise dose. And that's all I have. I'm turning it over to Tori now.
Thank you, Lex. That was excellent information. Um, so I'm going to touch on how may it help patients with Parkinson's disease first. Some of the signs and symptoms of Parkinson's disease include trouble sleeping, anxiety, which leads to low motivation, pain, fatigue, stiffness, and constipation. And the good news is medical marijuana may alleviate a lot of those. Um, for instance, sleep troubles, staying asleep would be one where you may want to choose a quick or fast acting product, such as a vape. Staying asleep, if that is more of your problem with sleeping, you would want to choose a therapy that may last a little bit longer. You can always do both as well too. A therapy like Lex mentioned that may last a little bit longer would possibly be a capsule or a tablet, as well as the lozenges or troches. It is shown to decrease pain. Pain really is a wide range of chronic pain, nerve pain, muscle spasms, inflammatory pain. When I think of inflammatory pain, my mind really goes to CBD as being in the product. So, say you had inflammatory pain, you may not want to choose a product with just THC. The addition of CBD would be very helpful in that regard. Uh, Improved mood, which decreased anxiety would then lead to increased motivation. Alleviate constipation. For instance, I was talking to Lex yesterday when using a tincture, which is made with oil, that would help with lubrication, which I found to be an important point to add there. And tinctures is basically a fancy word for a drop that you can put under your tongue sublingually. And also a decrease in tremors and rigidity as well. Um, Interestingly, a 2020 review that I was looking into of 14 different studies had acknowledged that medical marijuana provides a reduction in anxiety, tremors, involuntary and erratic movements in patients with Parkinson's disease. Um, Although these are kind of randomized controlled trials, still similar to say what you would see in prescription medications, there's limited limitations to the studies which still make the evidence inconclusive. Um, Examples being you're limited to the number of participants in the trial. Patients may be on different medications that don't match up in the same style. different ages of these people in the studies. So it's not necessarily inclusive on the product itself, but also the trial overall, with those factors taken into play. Um, and there's really an importance, I know that again, Lex touched upon, in choosing the correct product for the signs and symptoms that you're experiencing. Um, and when you get certified, you basically have the ability to choose whatever product you want to, or multiple products. So it's honestly like ordering off a menu when you're at a restaurant, which is totally different than prescription meds, which you essentially can't alter or vary that. Certainly, you go over the best fit for you with your physician, but at that point, it kind of stops. Um, so we're here as pharmacists to kind of help guide you, as well as the bud tenders. They're kind of, say, pharmacy technicians in the store that can pick the best product for you. And I know I mentioned the menu. My Tree's menu is accessible online, which I do like to play around with. Filters are your best friend. So when you go to the menu, you pick the location that best fits you, and you can essentially see all products that we have available. And there will be filters for to read reviews of products, how many stars people recommend, what dosage form, what does this product have, CBD or THC only. Sometimes, say, flower, for instance, there's hundreds of options on there. So at first it's very intimidating. I personally am an indecisive person, but if you filter for what you're looking for, you're going to have your best bet in deciding on an appropriate fit for yourself. And like I said, we can certainly go through that with you in the store as well too. But in case you wanted to take a glance there, it is all accessible online. Thank you. Next, we wanted to touch on safety precautions. These include cognitive impairment, dry mouth is very common, weight gain, cardiovascular risk. I wanted to go in more detail about cardiovascular risk, especially with tachycardia. You can see an increase of your heart rate for, say, 10 to 15 minutes after using a product. So it's something to be aware of. Same with orthostasis, or that's basically when you have low blood pressure, when you go from sitting or lying down to standing. Similar really to some of the therapies out there for Parkinson's disease. It is very important to weigh out the risks and benefits in that regard. Um, so, for example, there are a couple, the two that Lex and I were discussing. Um, for example, say you're driving or working, etc., cognitive impairment will be higher with higher doses of the medication. So, yes, I understand if you say a lot of people enjoy that high type feeling, but save that for times when you're not necessarily out and about as well. Also, very important in the medical marijuana world is to start low and go slow. Lex touched upon the tinctures. You can really get exact dosing on those. That would be a good place to start if you're new and naive. That would be essential to kind of avoid any of those side effects per se. Another example too, is you might immediately say, you know what, I have tachycardia, I don't want to risk this. But you have to really look at it by saying, is my tachycardia controlled? As well as, have I tried everything already to help ease my pain, whether that's with prescription medications or non-pharmacologic? If you have, then we can talk about products that may be a better fit for you to, say, avoid that tachycardia risk. I kind of like to look at it, I should have put a picture on here, really, of a bell curve. So it's really at the right dose and product. it will help. But if you have too much, it can hinder you too. I was just taking a look here, Lex, on the screen here. I can always pull it up for you. She was just having some trouble there with the presentation. So I wanted to make sure we get back with the slides here. There we go. Now I'll pass this back to Lex too for this slide. I actually just got a message from Lex. She's restarting her computer, so I'll continue on. Can you all hear me okay?
Yes.
Thank you. So I'll jump back to that slide, but I actually will discuss it in a few slides further here too. So wanted to touch on the future of cannabis policy. So marijuana itself right now is currently a Schedule 1 drug federally, meaning that the drug has a high potential for abuse and no currently accepted medical use. Yes, that sounds scary. However, the DEA most recently has set a hearing for December 2nd of this year to discuss the potential rescheduling of marijuana from a Schedule 1 to a Schedule 3. So this is a huge step in the federal cannabis regulation. So if rescheduled, it's really all about perception. So this would mean more funding for research. It would validate its use. It would change it to an accepted medical use, which is excellent. It would be easier for traveling out of state. Technically, unfortunately, you really can't pass state lines legally with medical marijuana. On the other hand, when they reschedule it, it may make it a little bit harder to access. So some of those Schedule 3 drugs right now, for example, um, you know, might have more stringent rules or a little bit more strict than say they really don't know how to regulate a Schedule 1 drug right now as opposed to one that is a Schedule 3. Currently, it's illegal in 24 states, including some to our borders. Relatively recently was Ohio. Although this is state specific, though, federal law again is more strict than the states themselves. So that's where it gets a little bit tricky, and there's definitely a gray area there. To give you a little bit of background on Pennsylvania itself, again, I know Lex had mentioned Pennsylvania's Medical Marijuana Act was signed into law in 2016. The dispensaries really got up and moving in 2018. Now the Medical Marijuana Act, I do like to touch upon, it did not decriminalize marijuana. Some lawmakers, though, argue it's actually a good thing that the state didn't decriminalize before creating it recreational. For instance, this in New York City, this is where they decriminalized it first, and there's actually a lot more illegal cannabis shops than legal dispensaries. So that's kind of a touchy subject as well, on that too. But that actually may have been a good thing for now until, we certainly try to move forward with the federal government as well as Pennsylvania itself. Fighting the stigma. Um, I did want to stress all of our products and really all approved dispensaries in Pennsylvania are tested to ensure quality. So you can see in the picture, I know it's a little bit blurry, but the labels themselves have percentage breakdown showing you exactly what's inside the product. So this would differ from an unapproved location, like for instance, vape shops. I know when I got into the industry, it was a time where on the news it would say vapes are killing teens. Well, this is unfortunate because certain people or companies were not approved were putting solvents in it that your body just cannot tolerate. So approved dispensaries test for solvents and even more things inside of the product to ensure quality control there. So I definitely like to stress that. My tree itself, we have our own grow facility in O'Hara Township that is heavily regulated as well, produces high quality products of all kinds. And then the next point that I always like to mention as something that I thought about getting into the industry is you really don't have to smoke or get quote high, as depicted in say Cheech and Chong long ago. Um, as Lex discussed, different products produce different effects on the cannabinoid system and terpenes. Topicals, for instance, you would never experience that quote high type product. Um, Similarly, when she was talking about the 1-to-1 ratios, those they kind of counteract to get the good parts of it and kind of negate that high feeling. But we can discuss that more in person or over the phone as well too. There are a couple common FAQs. One, I know Lex had mentioned the process of getting your card is not covered. Unfortunately, the products themselves also are not covered under insurance. We always have excellent specials that our team works to create. We offer discounts for veterans, seniors, students, people with state assistance. We're hopeful that one day we could probably cross that bridge, but unfortunately, at this time, we're not there yet.
Thanks, Tori.
Lex, are you on?
Yeah,
Perfect. Thank you.
I'm back.
Perfect.
Uh, so now
Take it
at this,
away.
yeah, thank you. My computer was doing too much, I guess. But okay, so we thought at this point, some of you might be wondering about strains, like we haven't mentioned strains at all yet, or sativa indica, if that's something you've heard before. So strains are tricky because I think some people kind of get fixated on sativa indica. Really, everything nowadays is a hybrid of the two. Everything's just been so crossbred that maybe it's a hybrid that's more sativa leaning or more indica leaning. But really, like what is determining the effects are those cannabinoids and terpenes. So Sativa indica is a useful guide, I think, especially when you're looking at a menu that has 150 products or more. It's nice to be able to filter it out based on, okay, I'm going to be using this during the daytime. Maybe I want to filter out and just see sativas. I'm hoping to use something during the nighttime. I actually want to be more sedated, so let me just look at the indicas. But then some people kind of start to think like, oh, well, I can't tolerate sativas. Or indicas, like they don't mix well with me. And so that rules out an entire class of potential medications for them. And so I guess, want folks to be aware that that sativa indica designation isn't the end all be all. It's important to look beyond that at the actual ingredients in the cannabis. So that's why we're kind of careful to use that terminology. And then another thing we thought like maybe there were some questions on what's Delta 8. So that's something we've seen pop up in the past few years. I'm always driving by vape shops advertising that. So what's Delta 8? How does it compare to the THC that we're familiar with? Um, Tori, do you want to just go to that next slide and then
Certainly, yeah.
jump back here? Okay, so they're very similar. The difference is that Delta 8 THC, it has that double bond on the eighth carbon instead of the Delta 9 THC is what historically the THC that we're familiar with, that double bond is on the ninth carbon. They have very similar effects in the body. The little bit of research that we have on them indicates that Delta 8 THC is about 2/3 as potent as Delta 9. So it has just slightly less binding affinity for cannabinoid receptors. So you can expect to feel the same kind of impairment, the same kind of intoxication head high with Delta 8 as you would with Delta 9. It just might be to a lesser degree. I mean, of course, if you you take you take a larger quantity of the Delta 8, then you know you'll reach a similar effect as the Delta 9. But at baseline, like equal milligrams, you're gonna see a slightly less potent effect from Delta 8. So of course, we don't recommend Delta 8 from those hemp dispensaries. Like Tori was saying, they just aren't very rigorous with their growing processes or testing processes. So you don't know what's in it: pesticides, fungicides, microbials, fungus that's grown, solvents. It tends to be really harsh, that Delta 8. So not a pleasant experience if you can get your card and get access to the Delta 9 THC that we have in our medical dispensaries. It's going to be a much better experience for you. And then last question we had there, a lot of patients come to Dispo and they're nervous. They're wondering, is it addictive? They don't want to swap their one addiction for another addiction. You know, they want to get off of their opioids, but they don't want to now be reliant on something else, cannabis. So what I always say to that, like when we think about addiction, we think about tolerance and withdrawal. So tolerance to cannabis is possible, depends on your individual chemistry, depends on the dose that you're taking, how long you've been medicating for. I've known some patients to stay on the same dose for years, but I've seen other patients who find a loss of efficacy within months. Um, So it really depends on the particular person. In case that you do develop tolerance, we, work together to maybe taper off, taper down on your dose. We could work on taking a tolerance break. So maybe a 48-hour kind of washout period. Um, you abstain from medicating for 2 days. And in that, those 48 hours would be tough. You'd likely be experiencing some withdrawal symptoms, insomnia, irritability, appetite dysregulation, malaise. But I feel like I need to emphasize that these withdrawal symptoms are relatively mild compared to um, traditional pharmaceuticals like opioid or benzo withdrawal. We know is life-threatening. Alcohol withdrawal, like life-threatening seizures, um, even caffeine withdrawal. Like I know I've had some awful splitting headaches, like if I haven't had my cup of coffee. So they're going to be withdrawal symptoms that we can work through. And I'll give out my personal number. Like I want to be a support to my patients. Um, I just encourage them, like, it's just 2 days. It's a hard 2 days, but it's going to be worth it. We're in this together. Um, you know, breathing techniques. Maybe we go back to some traditional pharmaceuticals. Maybe you're supplementing your pain with some NSAIDs for this period. We'd figure out a way to work through it. Um, yeah, I think that's that. And we have 10 minutes for questions. We wanted to leave a little bit more, but we still have 10 minutes. So
Mhm.
did anything come up during this? Anybody have any questions?
I do. I'm
Please.
Sharon. Can you do this for people who have Parkinson's psychosis, though, that have the hallucinations and delusions, and I mean really off the chart?
Yeah, that's a good question. Um, we would definitely proceed cautiously there. Cannabis has been known to like exacerbate psychosis. We would start very low and go very slowly. Like that's someone we'd want to be checking in on every week, while we find an appropriate dose. I don't personally, like, that wouldn't be a contraindication for me. Um, Tori, what's your feeling on that?
I agree with that. I think there's a lot of options, especially with the tinctures being such exact dosing that, for instance, that could be started at such a low dose, meaning even a few drops per se to see. That way, the worst that could happen is you don't feel the effects at that point. So I'm with you on that.
It's a
I
good
have a
point.
follow-up question to that.
Mhm.
Now, as a role of a pharmacist at a medical marijuana dispensary, what type of check-ins do you do? Like you were mentioning that you would check in weekly. I'm just curious how that would work.
Mhm. Yeah, it's really different at every dispensary. Like, but at my tree, anytime that we have a consult with the patient, we schedule a follow-up. Um, so whether that's going to be over email, over the phone, or they'll come in. Um, and then like if I don't hear from them, I'll send out an email just checking in and reminding them that We have these consults available for them anytime. They can schedule on the website. So yeah, I'll normally follow up within a week or two after I've worked with the patient, because I want to give them some time to actually try the medication and adjust to it and assess it.
Thank you.
That's a good question. We can definitely tailor it, like she said. And I do have one patient that I check in with his behavioral therapist and myself. Maitri's graciously offered the ability for me to check in with him weekly. So I talk to him about 30 minutes a week as well too. And he's definitely made some progression. So we have a little bit of leeway in that regard.
Can you kind of walk through like the process and like how you would determine what, um, which of the many, which of the products would be best suited?
Sure. So first we would, what are you dealing with? What symptoms are you looking to treat? And then we consider kind of like, okay, if you're looking to treat sleep, are you having difficulty falling asleep, or is it more that you're able to fall asleep, but you're waking up throughout the night? Tori kind of mentioned that, so that would dictate the specific formulation that we choose. So, if it's just trouble falling asleep, you would do something shorter acting, maybe a vape, maybe the tincture. If you're having trouble staying asleep through the night, if you're only getting 4-5 hours or less than that of sleep, then we do something like the gummy, the edible. That's going to last, give you that sustained effect throughout the night. Yeah, if pain and inflammation is something we're looking to treat, like Tori said, we want to have CBD in there for sure. In addition to the THC. It's really, what I like to do is give my patient options. I think what's special about this, as opposed to healthcare in general, is that the patient has autonomy here. You get to make the final decision. And I really just try to inform you. I just want you to have knowledge about the products and kind of help you kind of weigh the advantages and disadvantages. So I might recommend 2 or 3 different products for you and allow you to decide. And I might say, okay, this product might be the more conservative selection. But this product might be the more adventurous selection. So if you're feeling a little bit more adventurous, you're not so afraid of getting that high, maybe you're actually interested in having that boost. A lot of retired folks, that's an added bonus if they can have their pain treated, and they get a little mood boost at the end of the night. That's why a lot of people drink. So I kind of leave it up to you. Like, if you absolutely do not want to feel anything in your head, any kind of cognitive impairment, then we'll go with the more conservative selection.
Okay. Do you typically would you work with like my neurologist, for example? Do you do that kind of thing, or typically?
Yeah, I've definitely called doctors before. Not all of them are accessible, or open to this kind of thing.
Mhm.
I don't have any, like I said, I'm still relatively new to working full-time in this industry. Um, Tori, do you have any relationships with physicians?
Don't yet, but I feel like the door opened just recently with the behavioral therapist. So I feel as though we definitely have the ability outside of the consultations that we have scheduled online or that pop up randomly in the store that a new patient may come in and want a consultation. I don't see there being any problem where we could even all hop on a Zoom call and kind of discuss the options there, especially because we're all learning together on this. So I think that's a great point.
Thank you.
Absolutely.
I have another question. How often are pharmacists like the two of you available when you would go to a dispensary?
Oh yeah, we're always available as long
Okay.
as the dispensary is open, then there's a pharmacist on duty. Um, there isn't always a pharmacist on site, so our East Liberty location is always going to have a patient or pharmacist there. So we're staffed full time with on-site pharmacists. Um, Greensburg and Uniontown, it's sort of variable. Um, Laurie is our in-person pharmacist at Uniontown. But if she's not scheduled that day, then it might be Victoria who's working remotely. And so she'd hop on the phone with you. So we're always available to talk to. Uh, of course, I like the face-to-face interactions. I sometimes it's hard to like communicate effectively over the phone, and we're talking about such intimate things, like really personal pain journeys. So it's nice to be in person with folks. I'm grateful to be. I'm at the East Liberty location, so I'm there 3 days a week.
Thank you.
Mhm.
Can I ask a question real quick?
Hey.
Hi,
Hey.
Emily.
So I work with Lex at the My Tree in East Liberty, and I was just wondering, when we talk about Parkinson's, specifically like tremors, what would be the most beneficial product for people to get? Would it be more of a CBD and like less THC, and then we go with the terpenes, or would we want to do a 1-to-1?
Yeah, good question. I think we definitely want to do the 1-to-1. So, CBD we know is really good for anxiety, which the evidence around cannabis helping with Parkinson's related like spasticity and tremors, it's hard to say whether it's because the cannabis is disease modifying, or is it just that the cannabis is helping with anxiety, which we know anxiety can contribute to tremors. So they saw a reduction in tremor amplitude with cannabis, not tremor frequency, just the amplitude. But so that's why I think we definitely want to have the CBD in there because it's gonna be taking the anxiety angle. And then THC has been shown to be neuroprotective in preclinical and clinical studies. So we definitely want to have some THC in there as well. Again, like there's just not enough research for me to be able to say for sure. you know?
It's so individualized too. You know what I mean? What works for me might not work for this individual over here. So you have to work your way into it. You know what I mean? So that makes a lot of sense. And then with you saying earlier, tinctures would probably be your best bet because you can actually dose that appropriately versus like the troche that you can get in a milligram, cut it, but you can't guarantee you're getting what milligram you're trying to achieve. So we would want to stick with more like tinctures for people in this situation, correct?
Exactly. And I know that Parkinson's symptoms vary so much, like day to day and even throughout the day. Like if you're taking a levodopa, carbidopa, or any like dopaminergic agent, then you probably have the on-off periods throughout the day. So to have the tincture and to be able to dose down to the 1 milligram,
Yeah.
maybe you're on an on period and you don't need as much, you only need that 1 mg, but later in the day you're on an off period,
Yeah.
maybe you can add a drop or two to your dose.
Got you. And then like by the time you know your dose, you actually can almost foreshadow when you need to take it. That way you know you're getting ahead of the pain and getting ahead of the symptoms. So I like that. Thank you. Thank you.
Right. And I also feel like too, speaking of tinctures, it may be good to have a caregiver there if possible. I know that's not always able or an ideal world per se, but it is a dropper. So I know sometimes if you do have tremors or rigidity, you may not have the ability, if you are a patient with Parkinson's disease, to administer it as well. So that's another point, that if you may be living by yourself, so maybe we choose a different option in that regard. But tinctures, like Lex and Emily had mentioned, those I really think about having CBD in them. Hopefully other products will start to include CBD as well too. So I am pro tincture in that regard for that question as well.
Thank you. Any last questions before we conclude? Okay, I think it's a wrap. Thank you so much, Lex and Tori and Maitri. We really appreciate this webinar. And if you have questions, you send me a message and I'll connect you with Lex or Tori.
Thank you, everyone.
Okay,
This was
bye
a
for
pleasure.
now.
Thank
You're
you.
welcome. Thank you everyone for attending.
Take
Bye-bye.
care. Bye.
Bye.
Bye.